Hello, can you hear me? Hello, good afternoon. A very good afternoon to you, ladies and gentlemen. On behalf of AIIB, let me welcome you to today's presentation, Infrastructure for Planetary Health. My name is Jiang Ping. I'm from the Economics Department, and with my colleague Vera, we're going to go through some of the findings in our latest report. But let me just put on a few key remarks first before I pass the floor to Vera. AIIB is a young institution, only 9 years old. We have traveled a journey. We started with brick and mortar infrastructure financing, you name it, the roads, the power plants, the pipeline, the water, the sanitations, the drain, etc. COVID brought us the first moment of pivoting. So because of the health crisis, it jolted AIIB, and we started financing members' vaccine, social protection, healthcare projects, etc. through our COVID recovery facilities to the tune of almost $20 billion. So that was our first pivot towards health. If I may say so, the second moment of reckoning came from the devastating floods in Pakistan in 2022. I myself cannot forget, who can, right, of the satellite images that showed that almost 1/3 of Pakistan was inundated. This led AIIB to further introduce a disaster financing instrument in the middle of 2023. So we created yet another instrument to allow us to finance the recovery of countries suffering natural disasters. The effects of climate change are clearly upon us, from the heat waves of South Asia to the floods in Southeast Asia. In July 2024, AIIB took one more step to formalize an instrument, climate-based policy lending, to support our member countries for climate policy reforms, adaptation, mitigation, etc. So instead of a project-by-project basis, we are now financing into reform matrix of countries to help them implement changes to mitigate and adapt to climate change. Today, as we know, climate change, nature's degradations, these effects have profound impact on health and well-being. Let's face it, health effects are highly unequal. Our data is very clear. In rich countries, air pollution has relatively little impact on health because people can afford air purifiers, they can afford air conditioning, they go to the malls, they have private transport. So in some sense, you are able to insulate yourself from the environment. No such luxury for the populations in many developing economies. Heat waves are extremely unequal between a person living in an air-conditioned environment and a person living in informal housing under the zinc roof. It becomes an oven, literally, in the middle of the day. Climate change, nature, environment degradations, all have profound impact on health, and infrastructure has a role to help mitigate all these. So last year, in our report, Nature as Infrastructure, we started to have case studies and research into how infrastructure, nature itself, can be harnessed as infrastructure to help development. So this year, we went one step further. We linked infrastructure development with nature, with climate change, and with health. And Vera is going to go through some of our key findings as a title, Infrastructure for Planetary Health. AIIB is also developing a health strategy, which we'll soon bring to our board and to be approved in order to prioritize and channel our efforts and financings towards health projects, holistically speaking. Again, throughout my short kind of remarks, I want to share with you that AIIB is traveling this journey, and we will continue to travel this journey and respond to members' needs. Today, we are very grateful for the gathering of the experts here. Many thanks to Natalie, many thanks to Domiano. Edward is not here yet. Some of them will join us soon. And Mr. Ali for joining us. I hope to hear from the experts and give us your feedback, give us your intervention, share with us your experience. It will contribute to both this report as well as a health strategy that we're formulating. With that, let me pass the floor to Vera, and then look forward to a healthy discussion. Thank you.
Good afternoon, everyone. I just noticed as I had my headphones on that some headphones have very low volumes. You have a little way to manage that. If my voice is very low, you can actually increase the volume. Welcome, everyone. I'm so happy to be here at this kind of first Human Development Day of COP. Last year, it was the first ever health day at COP, so it took 28 COPs to realize that health is a critical and important part of climate change. I want to talk a little bit about this work that we have done this year. Each year we have a flagship report that comes out where we try to kind of communicate some of our findings and thinkings as an infrastructure investment bank. So we all know that health is a critical aspect for development, and our early findings were looking at that even with increased income in a lot of countries, that's not the only driver towards health. A lot of other aspects are drivers for health, whether it's education, whether it's access to water and sanitation, whether it's access to education and so forth. I just want to kind of take us back a little bit in this conversation. Some people here have a lot of background in health and some people have less background in health. But I think what critically is to understand here that human introduced changes to climate and environment are affecting our health and increasingly affecting our health. When we started to write this report early on this year, about a fourth of the total burden of disease and death was due to known environmental and avoidable environmental factors. As we speak now, and I think about 2 weeks ago, a report came out that pumped that number up to around almost a third of the causes of burden of disease and disability. So it's an increasing kind of avalanche that we're seeing in this space. It affects all of our organs in our bodies. It affects whether it's breathing polluted air, it affects our lungs, whether it's having access to contaminated soil that affects our brain development, whether it's being victims of floods and natural disasters. We can see rising temperatures resulting in increases in vector-borne diseases, for example. The list is very long, and I think I'll walk through some of these pieces. And I think also important to say is that we had a conversation early on this week, actually, or actually last week. We're Monday today, right? I'm losing the counts of the days. So last week we had a presentation specifically focused on air quality. So polluted air is the cause of over 8 million premature deaths globally right now. And this is also, of course, a staggering number. So we're seeing these different aspects affecting our health increasingly. We're going to talk a little bit different parts of the solutions in this conversation, but really prepping the healthcare system for these increasing effects on health due to climate change and nature degradation is critical. We have for many, many years tried to force a conversation on reaching universal health coverage, making sure that everyone has access to affordable and high quality health care. In that journey is now we have hit another sort of barrier to that is even complicating this journey due to climate change and nature degradation. And there's a need to really think through how we actually prep our healthcare systems. We're going to have some good examples for that. So how does an infrastructure investment bank come into this space? We kind of, as JP was saying earlier, we started this journey on looking at investments into healthcare quite early on in 2019, where we set up the social infrastructure department that now sort of became a mainstream department in all of our operations. And as JP was saying, we have also this year our first ever health strategy coming out. And we're very excited to say that health strategy will incorporate climate and health nexus and nature nexus. So that's also a great opportunity. Another part I think that is critically important in this space is to think about all of the other sectors. We're an infrastructure investment bank at our core, so our main sectors are whether it's energy, urban planning, or urban or rural planning, whether it's digital infrastructure, transport, and so forth. All of these sectors also can play a critical role, both in terms of improving the health outcomes from these type of other sectors, but also how to rethink it in the critical nexus between health, climate, and nature. So I always say to people that we've kind of gone from thinking about public health to thinking about planetary health, and that is with the understanding that our health is intrinsically linked to the health of our planet and to health of our ecosystems. And we're still not fully sitting with all of the information and facts on how this is happening. So it's important to continue investing research and financing into this. So I think we previously sort of discussed some of the findings from our report as well, and I think it's critical to say that climate change and nature degradation affects all populations differently. And we see that, for example, in countries, especially low-income countries, where there's a lack of access to resilient infrastructure, where there's a lack of access to healthcare in general, we see disproportional effects. In this case, we're looking at air pollution. We have high levels of air pollution in a lot of Middle Eastern countries, for example, but where you have an increasing access to air purifiers, indoor ventilations, and so forth. But in other places where you have a lack of this type of infrastructure, populations do not have a choice and are exposed to this. I was attending an earlier conversation today where one of the presentations of UNICEF was saying we need to also think about the disadvantaged groups in this conversation. Children, women, and elderly population are disproportionately affected, especially when it comes to air pollution. So also really keeping that in mind. And the same goes for water quality. We see that where there is a lack of water sanitation infrastructure, for example, it disproportionately affects low-income populations. And we also see a correlation between countries that have a high level of nature degradation and its life expectancy outcomes. So I'll just kind of try to summing up some of the findings that we had throughout this report. So the first one is that overall health has improved drastically over the last 30 years. We now live on average about 30 years longer than we did 40 years ago. Infant mortality, to just take one example, has decreased by 60% in the last 30 years. So these are major increases in life expectancy, in well-being, in the overall population. But we're now seeing that climate change and nature degradation is threatening these gains that we have so hardly fought to come through. Another example that we see when we did a study on air quality. So we looked at India and China in this example, and China had what they call a war on air pollution that started in sort of 2015, around 2015. And we looked at the overall effects of that, and we saw that the reality was that it's not only important to exchange away from coal-induced energy burning to renewable energy, but it's also really important to implement policies that enables, that facilitates that transition, but also extending grids, for example, and setting up functional mechanisms between different states and provinces to be able to exchange this energy consumption. So that was one thing that we saw, that it didn't actually translate to those changes until all of these things were in place. We also saw that rising temperatures are affecting infant mortality. We saw that actually 1 degree in temperature could increase infant mortality by 1% in the countries that we studied in Southeast Asia. We also saw that floods and higher temperature increases came as a result of floodings, for example, where we had an increase in waterborne diseases as a result of these floodings. And we also saw there was an increased push in terms of the actual effects on the healthcare system. So we saw that, I think I'll actually jump to this slide just to give you an example. This was the case of India, Indonesia, and Sri Lanka. And we saw that in the case of floodings, we had, so if you see on my right side here, the number of annual, this was leptospirosis cases after flood-affected districts. So you see that it increased by a large amount during these, after post-flood events in these areas. We also saw that in the case of Indonesia, the probability of contracting these waterborne diseases was 0.02% after flood events, and that alone led to a $29 million US dollars in cost due to these exceeded healthcare expenditure in that event alone. So these are just some numbers to show what actually happened as a result of that. I'll just take you back to this slide again. Another interesting finding, and I think maybe as we think about climate change and we think about like how can we transition to renewable energy sources and so forth. We saw that one study that we found and that we conducted on lead. So lead is used in a lot of solar panels, smaller solar panels. It's used in a lot of electric vehicles now, especially in low middle income countries. Lead is highly toxic to humans, studies find that about 1 in 3 children globally have elevated blood levels of lead, and there's no safe levels. So what we saw in our studies was that a lot of countries that have a really high import and a steady import of lead have a very low regulatory space for actually safe recycling this lead. So we see that a lot of countries are now trying to transition to more renewable sources of energy, are struggling with this problem of not having safe recycling facilities, and we're seeing the health consequences as a case for that. So it's also important to think about the whole sort of system as it's managed. I think this was just what I spoke about before in terms of seeing different countries taking action on air pollution. In the middle you see China, the reduce of actual levels of air pollution. In the case of India, who has started on this journey as well, in Indonesia, where it's still very early stages. So bottom line is that if there is a massive move towards phasing out fossil fuels, it is increasing the air quality and as a result improving people's health. Another study that we looked at was basically looking at, which we will discuss a little bit in this panel today as well, how are actual healthcare accessibility affected during different adverse weather events. And this was just a study that we looked at the accessibility in 3 different countries, Thailand, Cambodia and Vietnam, in the capital regions. And we see on the lower, you see the red kind of staples look at where we see an increase in driving time to reach healthcare facilities due to floods. In the black sort of on the top, we see that there's a loss of access. So that means that there's no access to healthcare facilities. So how do we actually prep the healthcare system when we need it, which is especially in these type of adverse weather events. I'll go back to the 2 last slides, and then I will invite the panel to this discussion. So another thing that we saw that we did on antimicrobial resistance was also that this is also an increasing threat to human health, and the links to climate change may be quite unknown, but when we see a rise in, for example, temperatures, that increases the probability of vector-borne diseases, which increases the amount of antibiotics used in those processes as well. So everything has a ripple effect when it comes to climate change, and we have these real consequences of antimicrobial resistance. So we've seen that when we increase, both in terms of policy space, interventions to reduce the antimicrobial resistance, we also see real effects in terms of improved health and life expectancy. Another one, which was really interesting, it's actually not a study that we conducted ourselves, but we worked together with the researchers that came out with this study. So it was really trying to look at like how does nature affect and how can sort of functional ecosystem provide health services to populations. So in one case, which was in India, there was a loss of or decline of vulture population in India, and that was due to intoxication. So vultures, they eat obviously deceased animals, and a lot of livestock was given a medication, which was basically anti-inflammatory medication that was highly toxic to vultures. We didn't know that at the time. This was a patent that expired in India. It absolutely increased the use of this medication in animals. So as a result, these researchers managed to quantify that vulture decline reduced on a yearly basis, it led to about 100,000 people or death on annual basis. That's just one example to kind of highlight that what we do to our nature has effects on our health, and we need to really understand those linkages better in how we do our interventions. So they are our natural recycling facilities, and we need to understand how we can invest in them. Another example was we looked at mangroves not only as flood protecting facilities, but also really protecting livelihoods, nutrition, and so forth. So we really tried to look at like how nature-based solutions can be incorporated and introduced into both infrastructure, but also seen as infrastructure. And I think our last flagship report was on nature as infrastructure. So although we are an infrastructure bank, I challenge you to think about infrastructure much broader than the traditional sort of mortar and bricks perspective. And then again, we looked at, how can we actually invest in different types of infrastructure that can both provide resilience and adaptation when it comes to health outcomes. And particularly, we looked at, for example, incorporating nature-based solutions, but also incorporating cooling infrastructure interventions and so forth. I think on that note, I will wrap up the last sort of conclusions of this report, and then I will invite our panel speakers. So we had 3 outcomes from this report. One is that we need to think about our healthcare systems in this challenge of climate. We need to make it more greener. It's about 5% of the global CO2 emission. That's about if you would think about that as a country, it's the 5th highest polluting country if healthcare was a country. So it's a massive amount of CO2 emission. So we need to green our infrastructure, we need to make it more resilient, and we need to make it more accessible. And I know that some of the panels will talk about that. Second part is that all infrastructure can have health benefits. And we need to think about all infrastructure in a way that we can actually incorporate the thinking around health. We can incorporate the thinking about nature, whether that is making more active use of modes of transportation, whether that is providing greening facilities and greening corridors in cities to reduce both air pollution and also heat impacts on population. And that goes to my last point, so really thinking about nature as infrastructure for health. How can we incorporate nature-based solutions increasingly to think about health? Green corridors is one example, but there's many, many examples. And I'll leave that to the panel to kind of touch upon some of the solutions, hopefully, in this space. So with no further ado, I would like to invite the panel speakers to come to the stage. And I know we have 2 of the panel speakers who are joining us very soon. But please, Liaquat Ali to the stage. He is the Director of Climate Change Program and Disaster Risk Management at BRAC in Bangladesh. Natalia Linou, Deputy Director of HIV and Health Group, UNDP. And Stephanie Speck, Head of... I think she's not here yet. Can you get me some water? I think they're on their way in, excuse me. Damiano um, Borgongono, sorry, please. He's the climate facility lead for UNC DF. And I think we're waiting for 2 more of our speakers who will join us shortly. So I want to open up, welcome to the panel, and welcome here. So I want to open up by kind of dwelling a little bit into what are the importance of thinking about climate, nature, and health integration into infrastructure financing in general. So maybe I'll start with you, Likat, from your experience of being the biggest NGO in Bangladesh, and I even heard one of the biggest in the world, working both in the climate space but in the health space, really working on the ground as well, understanding the difficulties and the challenges. Maybe you can speak to some of the work that has been done in Bangladesh and what do you see as sort of some of the solutions. So I'll give it over to you.
Thank you for inviting me. You can hear me? Okay. So you have already heard I'm from Bangladesh. So I will try to talk about more specifically about Bangladesh. You know, due to climate change, entire country, Bangladesh is affected because we are the delta country. But even though we have some climate vulnerable hotspot, say for example, hill tracts, we have hilly region, we have coastal region, and we have northeast flash flood region and also drought prone region, as well as we have flood prone region. There are some central portion where flood is coming every year. It's almost seasonal. So in the coast, you know, sea level is rising and more salinity is coming and more cyclone with high frequency and magnitude. So salinity, it brings us lots of new diseases. So say for example, it is now in our research and articles proved the saline water increases the hypertension and women reproductive health system was disrupted and eclampsia, and also the water is not drinkable and there are more and more vector-borne diseases. So that is the main problem. And in cyclone, you know, as I said, the intensity and magnitude is higher. It means during cyclone, the wash is the main problem, and also lots of death and injury occur during cyclone. And very recently, it is already prominent in the presentation about heat stress. So, you know, in Bangladesh, what we are facing, the dengue. You know, in 2022, we observed 20,000 deaths. And in 2023, we observed 15 times more. So, and time is also changes because it was always September to middle of October, but now it is September to even February. So time span is increased, and dengue and heat stroke is there. And you have mentioned about air pollution. I think in the news, global media, and also in the newspaper, you can see Dhaka city. Sometimes it becomes first, sometimes it becomes second. So every day we in the morning we see today we are first or second, because in our air we can trace lead. So that is a very serious respiratory problem. Is very pertinent. And you know, in Bangladesh, flood is very common, and at that time, first and foremost need is the wash facility. Drinking water and the sanitation facility is very much, and it relates to water level, because I will give some example. You know, in health system in Bangladesh, it starts from community levels. At the lowest tier is the union parishad. So there, every union level there is a community clinic, and then Upazila system, and then district system, and the national system. So in Bangladesh, in 2022, in southeastern zone, we have a flash flood which is a record of 122 years. In Cherrapunji, just beside Bangladesh, there is a rainfall event of 972 millimeters, and it all runs to Bangladesh. At the same time, we have almost 5 districts where rainfall was more than 300 millimeters. So everything goes underwater. Nothing left. Rail, road, highway, communication, electricity, mobile network, hospitals, nowhere. People have no place to go. So can you imagine what will be the system I just mentioned, the health system? Union Community Clinic goes underwater. There is storage, vaccines, snake bite medicine, life-saving medicines. They are kept in freeze. Everything is gone. So, and Upazila level, that is also happened during that time. And this year, we face already 5 disasters. Everything was related to climate change. Cyclone, flash flood, normal flood, and there is a huge 1 in 30 years return period flash flood in 11 districts. And we lost lots of life, and everything goes underwater. And the problem struck with the pregnant woman because the hospital system at community level was underwater. There is no place to give birth. And the infant and the babies, there is no place to give them treatment. And rescue is a big challenge. So what we can do? So we can do in a both way, because I'm coming to infrastructure. Say, for example, during this kind of disaster, climatic disaster, so if you have a facility, you can retrofit it, or you can take some measures so that in the coming days, you can cope with it, or you can adapt with it. Say, for example, if you at least make a room with a higher plinth level so that you can put your freezer to keep the medicine safe, and at least one facility so people can give birth, mother can give birth. So in that way, we can retrofit and redesign and think about for the future. But when you design new, that is very simple. You can consider the climatic projections, what will happen after 10, 15, 50, 20 years. Based on that, you can keep provision of air spaces. You can keep provision of water efficiency and electricity efficiency, renewable energy, less carbon emission. You can think about that. So we can design that. And, during that flood, and onto the medical facility I'm talking at the national level, if you go to the capital, you'll see lots of health infrastructure. Some of them are public, some of them are private. Because the private initiative, they are giving service to the people, no doubt about it. But their main intention is to give or make money or profit. So because of that, they always choose a piece of land with a very small in size and go for high rise. There is no space, there is no circulation, there is no electricity facility. So in that way, I think there has to be a policy. Sometimes a policy exists, but it was not implemented as such. So, design, when we design the new health facility, say, for example, in the presentation, we can see that the infrastructure, not only the health system. We have to think about the nature-based solution, also the nature itself. Say, for example, if air is polluted, it ultimately comes back to us in terms of health diseases. If soil is degraded, then it will affect the food system. So again, it's affect the nutrition, and it ultimately affect the health system. So in that way, if wash is a problem, so if you can drink dirty water during this disaster and flood, then it will outbreak the cholera and diarrhea. So and again, it will come back to your health. So we have to think about not only infrastructure, we have to think about infrastructure plus the nature itself. So today, if you destroy the nature will get back to us. It's happening. So what I am telling, this year we face 5 incidents of disaster. This is not the aim. It will increase because the projection so far we have we see it is going to be increased. So we have to be very careful about what we are talking and what will be the future we have in here. So I mentioned about policy. So policy for private sector and policy for public sector is needed. The government budget, you know, we are in a COP. This year COP is talking about the finance. So we are hopeful, we are expectable, and we are expecting more budget from the global Green Climate Fund, etc., etc. But these are not happening. So that's why I'm saying there has to be some mechanism so that government can allocate more budget. And also evidence-based advocacy, what we are just generating from the report, and also what we have experienced in the field, that has to be combined and do evidence-based advocacy and resilience infrastructure design. It is possible because in Bangladesh, we are dealing disaster very nicely. We are very good at it. So in cyclone shelter, during cyclone, people go and save their life, but they cannot save their assets and their agriculture in the field. So that's why we designed a small climate resilient infrastructure for the coastal, as well as for the flood prone, as well as for the drought prone area. So, you know, context-specific design is important for the resilience infrastructure, because when you construct a medical facility at the coast, you have to think about wind speed, we have to think about construction material, you have to think about salinity. Again, when you go to the flash flood zone, you have to think about the height of the flight and plinth level where it has to be fixed. So I will stop here. Thank you.
Thank you so much, Liaquat, for that. And I also want to welcome Eduardo Banson, Director of Health from AIIB, and Stephanie Speck from the Green Climate Fund. Very welcome. And what a perfect segue when we're talking about financing. And actually, Stephanie, the Green Climate Fund was mentioned here as you walked in, but I'll give you some time to breathe before I give you a question. But I think in that space, I think, Liaquat, you defined the problem very well in terms of, you know, what is happening to both the healthcare system, but also what is happening to people and what is needed for change. So maybe I'll go to Natalia from UNDP. So UNDP is doing a lot in this space in terms of different types of projects, looking at the nexus between climate and health. So maybe from a point of view of addressing a little bit in terms of solutions, addressing Liaquat's problem statement here, maybe talk us through a little bit of what your findings are and best lessons learned from your work.
Sure, thank you so much, and it's a real honor to be on this panel with all of you. So I come from the public health team at UNDP. We're a large organization. We have our climate hub, who are mostly here, our nature hub, our energy hub. We also have a governance team, and I'm the public health team. I'm a social epidemiologist, and that means I look at how health is shaped by the conditions outside of the health sector mostly, the built environment, nature, as well as, you know, social environment. So a lot of the work that UNDP is trying to do is connect the dots across our portfolios. We have real investments, and some of our main partners, the GCF is a main partner, for example, in early warning systems. We have real investments in agriculture. So to your report, the third bullet or the second bullet, like what is happening outside of the health sector, there's a lot happening. And bringing in a health perspective to that, to say, you know, if you were to invest in public transportation, you could have a triple win, a win for the economy, a win for the environment, and a win for the health. This is the way that UNDP is sort of starting to conceptualize solutions in an integrated way that don't serve a single purpose and ultimately are around the Sustainable Development Goals agenda and leaving no one behind. So what we have heard over and over again is that the climate crisis is a crisis, a health crisis, and actually the Paris Agreement is the biggest, you know, health agreement. It's also true that, you know, vulnerable, kind of excluded communities are going to be impacted the hardest and least stable. So UNDP thinks about the last mile quite a bit, reaching the communities that are hardest to reach. And we do that work across our portfolio. Within the health portfolio, we are looking at health systems. We're looking at low carbon, resilient, you know, health infrastructure that includes, for example, in Zimbabwe, solarizing the health facilities. And this was done because we were the PR for the Global Fund, and we were able to work together to sort of say, because vaccines, as you said, or can't be held at a temperature which is variable, an investment in sustainable energy that is also green and clean is a win across the sector. So, there are so many ways we're approaching this. We have a Nature for Health it's an MPTF. It's joined with WHO, with UNEP, with WOA, with others, where we're looking quite a bit at One Health. So this is, what is leading to vector-borne diseases and how can we address that in 5 countries. UNDP is leading the Ecuador piece with support from the Global Climate Facility. With support, we have this. We're exploring how to create a co-investment facility with WHO, UNEP, and GCF on climate and health, specifically around health systems and low carbon in about 15 countries under attached. So there's a lot that is happening both at the country level, at the local level. In northern Peru, for example, your mangroves example, that is happening. We're using mangroves to ensure that storms don't, like the rising seawater is improved, but also shellfish livelihoods. So I think UNDP's approach is that we have to think of livelihoods, equity, health, environment, all in one. And I took from your report this idea that, safeguards in the past, we were thinking about safeguards, right? Ensuring that our infrastructure projects, our projects were not harming the environment, we're not harming health, we're not harming gender, but that's not the frame. We need to be talking about wins and transforming it so that we actually are benefiting all the sectors. And I think that's what we need right now in an environment of limited resources and really leveraging each other's strengths. So UNDP is really excited to be a partner to many of the people who are doing this work. And I won't continue speaking so that we can hear from everyone, but I'd be happy to come back.
Thank you so much, Natalie, and I think that's very interesting to hear. What can actually be done on the ground. So I want to invite a little bit. We're talking about now actual solutions that are out there and that could be feasible. So maybe I'll jump first to. It's hard to say Eduardo because I know you as Dodo. So I will say. You're the Director of Health of AIIB. AIIB has been growing its health space in the last couple of years, and you're working with a lot of these countries that are called sort of climate hotspots, especially in Southeast Asia and Asia. What do you see in terms of actually being able to finance these type of projects, and what does the countries and members that you work with need, and like where do you see a good space moving in terms of financing for these countries?
Thanks, Vera, and sorry, apologies, I came in late, came from the other meeting on climate and health. I think, the way I would frame it is that we always talk health systems. We always say when we talk about investing in health, we look at health systems. So yet when we talk about in climate finance in health, we look at it like it's a project, it's like a incremental addition, and actually it incentivizes a lot of health people probably just to get some money from GCF to start arguing that certain interventions are already climate actions. When I think we should look at it, we should attack it from a very health systems perspective. So what's that system? So we know from a financing perspective that I just saw the draft numbers from WHO. About probably 10 trillion of spending in 2022. Of this, about 6 trillion is government budget. About 3.7 is about private sector. And external financing, including us in AIIB, is about 28 billion. Right? So we're at the most, if you look at those numbers, that's 99.7% government spending and private sector spending. And the external financing is small. So, we're essentially catalytic if we want to make a difference, right? And catalytic to those elements in the health system. So what's that? That means we need to have to engage, for example, what's within the health system, right? Health insurance. So we see a lot of countries having health insurance right now. It's a lot of countries' favorite UHC reform agenda. Yet we haven't seen how how health insurance, national health insurance, can be leveraged. We have not seen that work. It's a powerful financing tool, and it can actually, and we have seen it how it can make a lot of health infrastructure better, because you cannot be accredited, you cannot be contracted if you don't invest in certain QA actions and all that. Climate should be upfront and center. That you could not have health facilities contracted by health insurance in the future unless they undertake certain climate actions. And in a sense, and then you have this institution very much capable of monitoring this, because they're good at that. That's their job, right? Regulatory powers of government, right? We know that health, and that's why I love in the health sector, it's probably the most regulated sector. I even believe it's more regulated than nuclear power. Nothing can go into health sector unless you're licensed, think about it. No medicines can be sold unless it goes to a drug authority. Nobody can practice medicine or go into healthcare unless you're licensed. So this basically creates, again, a great approach where we could drive. Why can't all licensing of hospitals and health facilities require climate change? Move from safety is vintage 50s and 60s, which is how. So we start saying, let's help countries change their licensing rules, including doctors, medicines. That if we keep on talking low carbon pharmaceuticals, and look at it from a procurement perspective, when you can attack it from a regulatory perspective, where you could say nobody can sell, no pharmacy can be. So in a sense, these are. And so within AIIB, that's what we're looking right now. We're looking at this as we're also looking at existing laws, right? Lots of countries have energy efficiency laws, which the health sector totally disregards sometimes. So just getting this to be implemented in the health sector again. So this is our thinking now. We do not want to come in with nice little projects, right? Rather, we want to embed climate resilience and low carbon as part of the DNA of getting things done. Now, but of course, we need to have skills on that. We need to. I loaned to hospitals before, and I find it funny that a lot of ministries of health, you know how they build hospitals? Cut and paste. They look at the architectural design 20 years ago and just so. But then we tell them fix it, and they say give me consultants. So why can't we start helping them? And frankly, if you give this to ministries of health with all the CAD designs on how to make, they will do it. It's not that they don't want to do it; they just don't know how to do it. And since their expertise is not, so in a sense, these are the things we're looking at. I don't know. We call it leveraging the main sources of financing for health, like I call it that, embedding climate resilience and low carbon principles in a lot of the parts of the health systems. I'll stop there.
Thank you, Dodo. And it brings me back to actually a memory of a conference that you hosted maybe 10 years ago, 12 years ago. It's called the Hospitals of the Future, basically looking at like how we can build energy efficient and resilient healthcare infrastructure. And I think we're still, we need to incorporate that thinking when we build healthcare infrastructure. We're far away from that. So
I'm a bit more optimistic. I think the future is now.
That's good. So really interesting, and I think I want to segue into you, Stephanie, here with the Green Climate Fund. I think one of the thinking is like, how do we actually leverage? Whether we're debating whether it's climate funds or it's health funds, or like how do we integrate these two? We are here at this day where we need to think about this. I saw that you just financed one of your first climate and health projects. I think it was in Malawi that was recently. And we also heard here before you came that, I think, and I heard a lot, that a lot of people around in the health and climate space want to increasingly access this type of funding. So I just came from a meeting with the Minister of Health from Nigeria, and he was saying we want to access, funding from the Green Climate Fund in the space of climate and health. But he was kind of saying, what do we need to do to access this funding? So maybe I'll pose that question and let you answer.
Thank you very much, and apologies for being late. I was also at the panel on climate and health. It's a great thing having thematic days because you can focus your attention, but it means you're running around, as we say in Australia, like a chicken with your head cut off. Apologies to any vegans in the audience. It's a great question, this question of language, and you saw me roll my eyes. I find it really tiresome that we're still having this discussion. The first principle is that climate finance must be additional. That was the promise that was made back in the Paris Agreement in 2015. It must be additional. But then once you have additional finance, am I still on? Yes. That finance should work really hard to deliver co-benefits, whether that's in health, whether that's in education, whether that's in fragility and conflict. So the Green Climate Fund, we're always trying to think, what are the other benefits we can drive from this? It's a really interesting exercise at GCF when we're preparing for any discussions on health, because of course we always go to the data. What are we funding? What are we funding? What are we funding? And the first thing our teams come back with is, well, there's about, I think we're saying at the moment, around $300 or $400 million worth of projects that have indirect health benefits. Sounds a bit like a public relations exercise to me, and I come from a comms background, so I can spot them. But what I find a little shocking, and to be radically transparent, GCF is the largest of the multilateral climate funds. We have $16 billion committed and another $60 billion that have been co-mobilised through that catalytic finance. When we look at our portfolio and direct funding into direct health projects, where we may be funding a health systems transformation or a low-carbon infrastructure upgrade or even education or cooling storage, it's less than $100 million. And we're the largest. So that's either a huge risk or a huge opportunity, actually. And when we come back to the mechanisms that make climate finance flow, you will know that GCF funds $500 million into what we call our readiness program. Each country can access up to $7 million to build out their climate investment pipeline, to build their national coordination platforms and to do knowledge and learning activities. We signed up to the guiding principles on health along with the Global Fund, WHO and Rockefeller last year. And as part of that, we undertook to do some data scanning and metrics work. And we took 82 different climate planning documents from 50 different countries. NDCs, NAPs, HNAPs, which are the health NAPs. None of them had identified clear resource mobilisation pathways. There was a wish list of investment priorities, but none accompanied by, well, how will we find that money? Which tells me that, or tells not just me, but the rest of GCF, that actually that readiness programming that we're using is not being utilised enough in this particular sector, neither in education or other human development sectors. So there is an enormous opportunities for countries like Nigeria to come to GCF and say, how do we use that $4 million that we have to plan what a health investment pipeline would look like, and particularly one that delivers systemic transformation, not just a project here and a project there.
Thank you so much, Stephanie. I think that was very clear. It's hard to talk with these headphones on. Good on you. So I will turn to you, Damiano, and with the UNCDF. So I think, I think your director said the other day that UNCDF is a gem that has been hidden for 50 years. So I think it would be interesting to get your perspective. And what I took away from that previous conversation was really how UNCDF can be a facilitator, especially for low-income countries where there is not necessarily a market readiness for a lot of these type of both lending programs, but also interventions in the climate health space. And we also know that these countries are many times obviously the most disadvantaged and vulnerable in their populations. So I would love to hear from you, how do you see your organizations facilitating this space in terms of accessing more financing?
Perfect. Thank you so much. Thank you so much, Vera and the Asian Infrastructure Investment Bank for the invitation. Indeed, we're all aware now that developing countries need more investment, but there's an issue of capacity to afford it, because the reality that this is made worse by the cost of capital. And the injustice of the situation is that the poorer countries that are more at risk and that more need investment face a higher cost of capital. And there's a very interesting data from the Climate Policy Initiative on the construction of solar farms. But I think this is still relevant for everyone. That in Germany, investors need a return of 7% of the capital invested to come to a break-even. And CPI was mentioning that in the case of Zambia, that break-even is 38% of the cost of capital, which of course makes it extremely riskier and more complex to set up a solar farm in LDCs and seeds than compared to emerging economies or developed countries. So indeed, it's fundamental, and this is part of UNCDF role, to reduce the cost of capital for investment to happen. And indeed, UNCDF has been around for a long while. It was actually created by the General Assembly of the UN in 1966. Now our executive secretary, as you were mentioning on Friday, is re-strengthening the purpose and the vision of UNCDF as an hybrid development and finance organization, the only UN fund apart from IFAD which is tasked of implementing climate-related actions at the country level, with the objective of de-risking investment and enhancing capital access. So de-risking, it's about taking the first risk, taking the first loss, and this is UNCDF task, and creating the space and the opportunities for example, for MDBs and for other private stakeholders then to enter. And UNCDF main geographical area is LDCs and seeds. I also want to comment on a point made by Stefanino, and my experience working at the country level in developing countries, is that often we don't see much proposal on health infrastructure, for example, because I tend to sense that in many countries, climate action is still seen as an environmental area. And indeed, most of the UNSC focal points, where are they based? Ministry of Environment. GEF focal points, where are they based? Ministry of Environment. And while there are efforts through national climate change committees to really bring in stakeholders from other areas, but still the stakeholders from health ministries are, when they attend, they are in significant minority. So there's also a need to build further awareness with a stronger role by the ministries of finance, so that those needs are presented to the Ministry of Finance, and that the Ministry of Finance can reach out to UNCDF or can reach out to MDBs, can provide the opportunities in developing an investment pipeline, so that then these proposals can either be presented to multilateral funds, among others GCF and GEF, but also can create the opportunities, for example, through private-public partnership to invest. There are several areas that can be invested. It can be, of course, energy efficiency, which is usually an easy win. In particular, in LDCs and seeds that are based in tropical countries, air conditioning, when they exist, tend to use very antiquated models, extremely inefficient. It's about generating renewable energy. And again, luckily the cost of solar panel have collapsed over recent years, while the cost of diesel, which usually most hospitals in LDCs and seeds, electricity, either it comes from the grid, but unfortunately it's very unreliable, or hospitals or health centers have diesel-based generator, extremely expensive, and also when a disaster strikes, there's no more way to bring in diesel, and of course, how can you have a functioning health center or hospital if you have no electricity? Waste management. And there's more to be done. It's happy to see how health is increasing in importance in this kind of COP. My first COP in Mexico, it was 2010. Never heard once the mention of a nexus between health and climate. Yeah. Now this is one of several events which is happening. We have an health day, so it's important, but this needs to step up, of course. And an organization like UNCTF, organization as AIIB, ADB, AFDB, we have to play a stronger role. Thank you.
Thank you, Damiano, and I couldn't agree more that we, unfortunately we left out the health thinking in the climate thinking, and I always say maybe that was because we were thinking about the polar bear on a melting ice shack instead of thinking about ourselves, and maybe we were blaming ourselves instead of thinking that we were actually the victims of this as well. So I'm happy we are here now and in a different sense understanding this issue. I want to maybe have a quick round in terms of looking at, we've sort of described the problem, we have looked at what potential solutions are out there. I spoke to Liakit and also Natalia before in terms of how do you integrate nature-based solutions. This is something that is really hard for a lot of countries that have very little land to actually utilize for these type of solutions. But as some of our findings see that when you do incorporate nature-based solutions, you can have increasing important health outcomes. Whether that is green spaces in cities, whether that is green corridors to reduce health stress, whether that is mangroves and so forth. I wanted to just maybe get a quick answer from you both in terms of what you have seen that has worked and maybe one example each from nature-based solutions that have kind of been able to incorporate this health thinking and really, maybe I can start with you, Natalia.
Sure. And so I mentioned the mangroves early on, but in terms of infrastructure, I was talking to our colleagues who do the nature for health work, and they were saying in many countries, roads, if they're near sort of mountains, the soil gets so degraded that you have this risk of landslide. So really investing in building up the forests and the soils there is one example. Also with dams and sort of the soil degradation again is causing kind of the dams to lose their ability and filtration. So there's a lot of nature-based solutions to retrofit existing sort of investments in infrastructure that is happening with UNDP, but I think the more creative approach is what are we doing in cities, green buildings, what are we doing in schools, and thinking about how do we build for a future that incorporates, but I think we need to be doing both, retrofitting because the infrastructure is there and building anew.
Thank you, Natalia.
Yeah. As I mentioned, 1/3 of our country is in the coast. So cyclones are very common. You also know we have a biggest mangrove forest. It's called Sundarban. So this is full of biodiversity and ecosystem. And earlier this trend of cyclone is southeast. It is other part of the country. But nowadays it's shifted to southwest. It means when there is a cyclone, it first hits the Sundarban. Sundarban itself damaged, but it takes the burden to save the country. So it shows us if you have a what you call biodiversity or nature-based solution, so it can save your country and other infrastructure you have built so far there. So yeah, based on this experience, we have started to the mangrove plantation does not grow by planting. It automatically grown. You cannot disturb. But we started by planting from seed from that forest, and it start growing. So we have already successfully grown 50 acres of land, and we created another mangrove plantation so that it will gives us protection from cyclone and all these things. When cyclones come, all the lowest tier of healthcare facilities goes destroyed or underwater, so it will protect. So this kind of nature-based solution is working, as well as country is we are land-hungry country. We have lots of people, 160 million people with a very small size. So we don't have enough space to construct a very greenery or green hospitals, except saving the water efficiency or the energy efficiency. So that's we are trying, and hopefully that can be easily achievable.
Thank you, Liaquat. I think that is a critical issue for not only for Bangladesh but for a lot of countries when it comes to this type of solutions. I maybe want to pose a question a little bit to Stephanie and to Dodo and potentially even to Damiano. When we look at these type of solutions, when we talk about climate and health, it's really issues that go across a lot of different sectors. It's a lot of projects that has to speak to a lot of different line ministries, complicating things further. We always talk about the healthcare sector is very siloed, it's whether it's non-communicable diseases or communicable diseases, so forth. Now we add another layer to it. Now we maybe, for a lot of these type of investments, we need to talk to finance ministries, we need to talk to healthcare ministries, we need to talk to environmental ministries, and we need to talk to, other type of ministries. So maybe I'll pose the question, and maybe you can go around through the three of you to say what, from your perspective and from your end, what could be facilitated, for these type of projects to work more in tandem between line ministries. It is very complex. And what can, from you each individual organization's perspective, what have you seen worked, or what in your experience can be done to facilitate a more integrated approach when we think about these issues? Maybe I'll start with you, Stephanie.
And I want to make two comments, one around how national systems work, and the second is around a sectoral approach. I'm so tired. If I forget the sectoral approach, can you just remind me? Because I don't know what I'm talking about. One day at COP's like 30 years on the outside of the bubble. Look, I've worked in more than 20 countries over the last 25 years, and often sitting at the heart of government, working with heads of state to help countries that are emerging from conflict to develop into democratic states. So I know very well the competitive nature of financing, any financing that comes into countries from donors, climate, whatever kind of financing. And often the ministry into which that funding goes seeks to hold on to it very securely, because that is power and that is position. And in countries where you are fighting constantly for your role in the cabinet, then that's what you do. You bring in investment and you are somewhat protected. I think too that we've spent a lot of time strengthening the Ministry of Finance in different countries and not strengthening other ministries appropriately, because they've been seen as the softer ministries. And we know that those softer ministries, those ministries that sit at the heart of human development, education, health, social protection, are the ones that are going to keep things going when the harder ministries fail, actually. And they are the ministries that are going to have to keep national budgets healthy in the future. So I don't like the idea, actually, of seeking to further strengthen the Ministry of Finance by making them the conduit for funding. That's where national coordination platforms are absolutely critical. That's where cabinet structures are really critical, and using climate finance in ways to trigger cabinet structures or to incentivise cabinet structures to work better is something that we should be doing, and it's something that we're actively working at GCF in some of the world's most vulnerable countries. We've spent a lot of time with Somalia over the last three months, and we had a intense week with their planning team at our board meeting to say, how do you act as a gateway, and not into a cell where you're holding onto that finance, but how does the finance enter through you, and how do you distribute that, and how do you work with the Ministry of Agriculture and the Ministry of Fisheries and the Ministry of Education to make sure that finance goes through. So I think there's an important role for climate finance to be determined in its non-competitive and instead to incentivise the way that country and cabinet and planning decisions are made. The second quick comment I'll make is on a sectoral approach. Been stewing this for the last few months because I lead our vulnerability portfolio at GCF, and I see again in my experience in places like Somalia, Afghanistan, Iraq, as soon as you start taking a sectoral approach, you add to competitiveness. I actually want to start GCF thinking about moments. What are the intervention moments for finance? What is that back from fragility? What is that preventative space around adaptation, around social protection, around shock responsive mechanisms? Can we talk about moments rather than sectors, and then use those moments to fund cross-sectorally? Another moment would be this protracted crisis space where humanitarian organisations want to get out, but countries are not ready to take on development finance. Is there space for climate finance in that resilient space, again, where we can work cross-sectorally? And when we're talking about human development ministries and initiatives, I think that's critical.
Thank you, Stephanie. I'll give the word over to to Dodo.
Thanks, Vera. So I think the question, as I understand it, is how can we get the different, how the health sector could work with other ministries as they work on climate action. The COP helped a lot, okay? Because part of what I see when I work with governments, right, with different ministries, and I also work in government before, is that if the message comes from health, it will be, by health people, it will be perceived as a self-interest. Education, same thing. And then everybody will have his own studies to argue why they're the most important ministry in the world, right? Now, COP basically, the last few years, have actually said that there's a global message now that climate is a health concern, right? And the statements coming from COP, which is including statements that say this is the greatest public health threat and all of that, in a sense coming from objective global messages, helps a lot. So that's how I guide ministries of health now. Refer to what the world is telling us, that this is a climate action. Okay, and that actually has helped a lot with the ministries of health, because when they engage now with Ministry of Environment or Finance, and there's a lot of Ministry of Finance now engaged in climate action, it's no longer a Ministry of Health saying because they want more money. It's asking the other ministries to basically support taking on health action. And so that's the change I've seen. To, like, when we have the meeting before, when we had that future-proofing hospital meeting before, it was very hard to move forward outside the health sector. Now we have seen in countries energy ministries coming in and all that. The second thing is that I think the science have improved. I used to react, I have to say, I'm really so angry before when I talk about, let's say, the health impact. And the answer is that it's malaria only. It's like, why you think climate will only make the vector diseases the only thing? Don't you guys suffer from heat? I'm a big guy. I suffer. Heat stress is something I have to live with. And so now the science have broadened really to the point that we now look at the health impact of climate as more than just a vector store. It is still a major thing, right? Particularly for those in tropical countries like where I live, right? But it's more than that. I think that's been powerful, because that has allowed us to argue, to strengthen our argument, which we've all been arguing, that strengthening health system is key for climate adaptation. Then, of course, something happened called the pandemic. And we know what the pandemic showed. If your health system's good, we're able to survive it well. If you were weak, then you have a problem, and then your economy also becomes bad because of that. So I think these are the things we have seen. Now, what's interesting with what you guys are doing in this infrastructure is that, frankly, in health, that got left behind, because also most of the health ministries, leadership, don't know how to build infrastructure. They just simply bid that out, or they let somebody else, right? If you look at, in lots of countries, I seldom see health people who are experts on health infrastructure, or on how to green. They love to use all of the fancy acronyms, right? LEAD, nobody knows what LEAD. I like Leeds football team, but not, And so so building up this expertise, and hopefully we in AIIB are working on that, you guys. So we could start, and as I said earlier, in a lot of countries, ministries of health cut and paste. They just look at how a hospital was designed, probably by an AIIB consultant team 20 years ago, and then used it again on new health infrastructure. We look at primary care facilities. It has not changed. It still looks like it was 30 years ago. So why? I'm now using a phone here, which is, and I remember pagers and all, but why haven't we changed how hospitals? We have great examples, like Singapore. I always tell Singapore, the Copiatech, this is one that uses nature, right? Why are you the only one still up to now? Why haven't all the other hospitals, even in Singapore, started to become like who you are? And why? And it's not as if you're that expensive to build, right? So in a sense, hopefully, this will start a movement where we start getting better ideas on how to build infrastructure. And we know that's very important. Climate resilient, low carbon health infrastructure And I go to my final point, and I always love saying this, that health people actually have a moral imperative to make all health infrastructure net zero. Because unlike other sectors, when people die from climate change or get sick, it's health people who take care of them. So if you take care of them, you're morally obliged that your sector, your very sector, should not be contributing to the cause of the death. That's like shooting yourself, right? Or there are doctors smoking. So in a sense, the health sector, health ministry should be more than any other sector, even before education, really aspire for net zero. And we should help them do that because they cannot do it on their own. We need to help them imagine, develop, decarbonize, not tomorrow, but now. And hopefully GCF, I'm looking at GCF, can give ADB, so we can start talking with GCF so we could mobilize more money for that. And hopefully you get better project proposals.
Thank you so much, Dodo. I'll give the last word to Damiano, and maybe I tweak your question, one very short answer, but maybe just to say in terms of how we have a lot of different funders, different organizations here. I know you've worn different hats. What do you think maybe very shortly could facilitate the collaboration between different partners in this space?
To the extent possible, through the UN country teams at the country level. No? UN country teams is a space where all UN agencies and often MDBs come together. And we at the UN system, we have what we call in our jargon the UNDAF, and everyone is there. And I've seen it many times that then we mention health led by WHO and other agencies, but then the spirit of collaboration disappears because we have to do it once every 5 years and then we forget about it. But it's really, as more and more colleagues and agencies and MDBs and funds get to know about this, we also need to transmit this at the country level. As our global regional level, it's easier. We meet at COP or the equivalent and we discuss, but what makes an impact is there at the country level. And if you allow me, I also wanted to add an additional comment on something where I think things could be done better in terms of health and climate infrastructure. For those of us that spend or spending times in developing countries working with the UN or NGOs, the most common investment in terms of health and climate tend to be small solar panels in health centers. Because it's a nice idea, it has a huge potential health benefit if well done, but in most of the cases, I'm personally disappointed. Why? Because we see it the easiest way, which is energy as a procurement. I go, I build. This applies to, I think, every UN agency. Yeah? So I go, I build, and I leave. And then I forget that there's a part which is operation and maintenance. And it's just naive to think that someone, especially in an isolated, small part of a country, will have the knowledge to then fix it. And I've seen it with my own eyes, lots of very nice projects done that after 5 or 6 years just are working. As soon as whether there's a storm or a branch falls on the solar panels and there's an issue, it stops. That money didn't provide any sustainable support to the community. So it's switching from energy as procurement to energy as a service, which is, again, it's how there is so that the service provided by the private sector, and in Africa, the very interesting scheme can step in and take care of operation and maintenance, taking care of the installation in exchange for a small fees. Thank you.
Thank you so much, Damiano, and thank you for all the panel for your fantastic insights and comments. And I want to bring the word over to Maria Neira, who has been, if not the guiding star in this conversation around climate and health, one of them, absolutely. And I know that we are all grateful to be here at COP because of a lot of your hard work over the years in bringing this conversation to light. So thank you so much for that, first and foremost. And who better to close this session and some final remarks than you. So please welcome to the stage.
Thank you so much for this amazing introduction and presentation. And I love very much as well to have provocative statements. And I think, Damiano, this gives us an opportunity to go through all of that. Health is not only what's happened at the hospital level. That's very, very clear. What's happened at the hospital level is that you don't have health any longer, and then you need to get treatment. So for me, as a medical officer that I was, and a real clinician that I was a long time ago, but I still feel it, health is what's happened in the energy sector, in the agricultural sector, in the environmental sector, in the water sector, name it. Because what's happened at the hospital is not health. It's because we fail on preventing health outcomes, we are going to the hospital. So this is the first thing. So when I was in Beijing a few months ago, and I have the opportunity to visit the AIIB, first of all, I was super impressed by the facilities they have. Mamma mia, it was really beautiful, and in addition to that, I think it's totally environmentally friendly and, probably not totally zero carbon neutral, but I'm sure that you are very much concerned about that. Well, this is exactly what the health people will ask you to do. Whenever you lend money to build a hospital, don't just put the money on the infrastructure. That's not health. That Damiano is right. We need to make sure we have hospitals around and healthcare facility in many parts of the world where we have only the infrastructure. Without the day the hospital is finished, the construction is finished, we don't have facilities, we don't have water, we don't have electricity, and all of this remains. So that's certainly not the way. Having solar or photovoltaic energy is a way for us to accelerate this transition to clean sources of energy. So it's definitely a need, and a need to respond to those very isolated healthcare facilities where, as you know, more than 1 billion people today is going to seek health care in places where there is zero electricity or non-reliable electricity. And it's not fun. I've been working on those healthcare facilities in Africa and Central America, and it's not fun for a doctor to have a diesel or a lamp of kerosene and take care of a patient. That's horrible. So, but I fully agree that we need maintenance. So it's out of question to see, as we saw in many healthcare facilities in Africa, one remote healthcare facility with 3 solar panels on the roof, one to deliver a vaccine, another one because it was an organization with a very clear mandate on a vaccine, or another one because the cooperation of I don't know which country was passing by and decided to offer that, and the electricity not working because none of these 3 panels. So what we are trying to do is to use our brain, upgrade the capacity of those solar panels in order to provide electricity to the whole healthcare facility and maintenance. So it's a service. I fully agree. And that has to be accelerated because at the moment we still have healthcare facilities spending 50% of their health expenditure in diesel generators. I don't know whether you work on places with diesel generators. It's noisy, it's polluted, it's dark, it's horrible. And it spends a lot of money, and it creates insecurity as well. So for me, it's all about this multi-sectorial collaboration, certainly with energy, certainly with the infrastructure banks, certainly with all the engineers that will be providing all of those services and infrastructure. And health will be very much ready to be part of this and bringing the health benefits that can be obtained. So I know that you can mobilize on infrastructure big financial support. what we want from you is green health. We will be happy to work with you on defining what is green health. How can we all make sure that there will not be failures like lack of maintenance on solar panels? And we need to make sure as well that it's not just because it's funny, it's nice, and some people want to just to deliver, but we need to, we can obtain enormous health benefits, and not only, we can be much more cost effective on the use of the financial resources for the health sector that at the moment are very, very short. So remember the report we launched at the COP, which says health is the argument for climate action, but health is not at the hospitals, it's outside the hospital. Thank you very much.
We have maybe last few minutes, but let me first thank Maria for gracing the event, for giving such an inspiring closing remark, and thanks Vera for hosting the session, the presentation, and all the panelists. Allow me just 2 minutes to really just share something which I think is important. In my opening remarks, I described to the audience and you the journey that AIIB took from just project by project financing to now policy-based lending for climate, and now to a health strategy, and so on. I really want to acknowledge Damiano's point that there is a journey from just COP, you said, now recognizing health as an important issue. Let me share with you another 2 journeys that I felt gave me some optimism. I'm beginning to see more and more mitigation projects that try to limit the impact of climate change on health. And finally, I'm happy to say that today, AIIB, we are receiving private sector inquiries on how to do nature-based solution. So this is very new to me. When I saw those proposals coming from the private sector banks that they want to do nature-based solution, how to do sub-projects, that it is very encouraging, because that is another journey that private sector is coming to us. Finally, let me say the word to Lakith. We are now financing Bangladesh, together with ADB's, the climate policy transition, and hopefully all the nature-based solutions, all the good things, early warning system, water management, flood controls, will start to enter into the kind of projects we do for Bangladesh and improve the overall health prospects. Ladies and gentlemen, many thanks again for traveling the journey with us, and a round of applause to our speakers. Thank you very much.